Did you know that Esau and Jacob aren't the only set of twins in the Bible? Let's look at the story of another set of twins whose birth was quite fascinating. But first, a fun fact. Did you know that twins can have two different fathers? It sounds unbelievable, but it's medically possible. It's called heteropaternal superfecundation. So here's how it happens. A woman releases two eggs during her cycle, and then she has intercourse with two different men within a short period of time. So each egg gets fertilized by sperm from different men. The result? Twins with two different fathers. Yes, heteropaternal superfecundation is uncommon, but it's not a myth. There are actually confirmed and documented cases. So back to our story. So this woman named Tamar is in labor, and even the way she gets pregnant, it's so outrageous, but that's a story for another day. As she's in labor, a tiny hand appears. Not a head, not a full baby, just a hand. Quickly, the midwife ties a scarlet thread around the baby's hand and says, "This one came out first, this is the firstborn." But something shocking happens. The hand disappears, suddenly pulled back inside. And before anyone could react, another baby forces his way out completely. And the baby with the scarlet thread on his hand comes out next, automatically being the second-born. The baby with the scarlet thread was named Zerah, meaning scarlet. And the other baby who broke through was named Perez, meaning breakthrough, breaking out, or in some translations, breech. And that brings us to our topic for today, breech presentations. Normally, during birth, a baby comes out head first, but sometimes that doesn't happen. Instead, the baby is positioned differently, and this is called breech presentation. That means the baby's buttocks, legs, or feet come out first instead of the head. So let's look at different types of breech presentations. So the first type that we have is the Frank's breech, and in this case, the baby's buttocks comes out first with the legs being straight up. So next, we have the complete breech. In this case, the baby is sitting cross-legged in the uterus and the buttocks are positioned to come out first. We also have the incomplete breech. In this case, one of the baby's legs is flexed while the other one is extended and the baby's buttocks are still positioned to come out first. Then we have the footling breech, where one or both feet comes out first. Okay, so remember in our story, a baby's hand came out first, right? But interestingly, in modern medicine, a baby's hand coming out first isn't typically called a breech. It's actually called a compound presentation, where the hand comes alongside the head. And in rare cases, that hand can even go back in, just like we see in this story. Now, I'm sure you're wondering, why is it so important for the baby's head to come out first? Let me tell you. A baby's head is usually the largest and least flexible part of the body. If the head comes out first, it helps to open the way for the rest of the body. Once the head is out, the shoulders and the rest of the body usually follow easily. Secondly, oxygen supply to the baby depends on the head coming out first. While inside the womb, the baby gets oxygen through the placenta, not by breathing. In a breech birth, the baby's head can get stuck inside, and this is called head entrapment. And in that moment, the umbilical cord can get squeezed or compressed, like stepping on a hose, thereby reducing the flow of oxygen to the baby. And as the delivery progresses, the placenta can begin to detach, cutting off oxygen even more. This situation can lead to birth asphyxia. And if this lack of oxygen is severe or lasts for too long, it can become life-threatening. And in worst-case scenarios, it can result in a stillbirth. That's why in these moments, time is absolutely critical. Doctors have to act quickly to deliver the baby as fast and as safely as possible. And finally, the head-first position allows gradual pressure on the skull, which is safer for the brain of the baby. So what is done when a baby is in breech position? What is done actually depends on when the breech is discovered and the specific situation. If the breech is detected before delivery, usually around 36 to 37 weeks, the doctor tries to manually turn the baby from the outside by pressing on the abdomen, and this is called an external cephalic version, and the success rate is about 50 to 60%. If the ECV works, then the patient can likely have a normal vaginal delivery. But if the baby stays in breech, then the safest option is a planned cesarean section. A selected vaginal breech delivery can also take place, but it's only allowed if the hospital has experienced doctors and if the baby is in favorable breech position, such as the Frank's breech, and if there are no other complications. On the other hand, if the breech is discovered during labor, then an emergency C-section is carried out quickly. But if the baby is already very close to delivery, then a skilled doctor may assist in a breech vaginal birth. If the baby's head gets stuck, then the doctors have to perform an episiotomy. This is an incision made in the perineum during childbirth to widen the vaginal opening. In some cases, doctors use special maneuvers to guide and flex the baby's head out. In other cases, they use special instruments like forceps or vacuums to assist the delivery. Now back to our story. This story isn't just about biology, it shows a powerful pattern seen all throughout scripture. Perez wasn't marked. He wasn't the one with the scarlet thread. He was not supposed to be first, yet he broke through. And here's where it even gets deeper. From the line of Perez came King David, and generations later, from that same line came Jesus Christ. All from a child who wasn't supposed to come first, but did. So, sometimes the story isn't about who starts ahead, it's about who breaks through. Well, if you enjoyed this, stick around because there's a lot more biblical and medical mysteries to unravel. Please like, subscribe, and hit that notification bell.